What are the gradings for depth of burns? Depending on the depth of burns, this may be: first-degree burns, involves only the epidermis, no blister, only erythema. Heals in 3 to 4 days by peeling off of the epidermis. Second-degree burns may be: superficial dermal burns, involves the upper layer of the dermis. Forms blisters, and on removal of blisters, wound is pink, wet, sensitive and blanches on pressure. Heals in 3 weeks by epithelialization. Assessment of burn area in deep dermal burns, children, involves the reticular layer of the dermis. Forms blisters, and on removal of the blister the wound is white, dry and capillary refilling occurs slowly or absent. Heals in 3 to 9 weeks with scarring. Third-degree burns or full-thickness burns, involves all the layers of the dermis. No blisters. The wound may be white, cherry red or black and is leathery, firm in feel, insensitive, do not blanch on pressure. All epithelial elements are destroyed, and there is no potential for healing by epithelialization. Fourth-degree burns, involves all the layers of the skin, subcutaneous fat and the variable amount of deeper structures. The wound is covered by a thick eschar. Alternatively, the burns may also be classified as superficial burns, includes the first degree and the superficial dermal burns. Deep burns, involves the second degree deep dermal, third degree or full thickness burns and the fourth degree burns.